One of the most important parts of exercise is understanding the principles of the exercise. These principles include frequency, how often one exercises, intensity, how hard one exercises, time, how long exercise lasts, and type, the type of exercise one uses. This can be shortened to the fitting acronym of FIT. The first principle, frequency, states that the appropriate amount of exercise can vary for what type of workout someone is looking for. It is recommended to do aerobic exercise around 3 to 5 days a week. It is also recommended that one works each muscle group 2 to 3 days out of the week. Each person should take into thought, though, about their personal fitness level and fitness goals before doing the recommended amount of exercise. The next principle is intensity. Intensity of exercise is important as to make sure that someone is not overworking themselves. Max heart rate changes each year, so checking it is very important. This is done by subtracting 220 to your current age. Intensity also varies for certain people who are severely deconditioned should do a light to moderate workout that should reach only 30 to 40% of your max heart rate, while novices should have a moderate to vigorous workout by only reaching 60 to 70% of the max heart rate. Experienced people can work over 80% of max heart rate. The third principle is time. The recommended time for moderate intensity is to exercise for 30 to 60 minutes. For people looking for a vigorous workout, it is recommended to do so for 20 to 60 minutes. You do not have to continuously exercise for 60 minutes though, as these can be broken down into bouts of at least 10 minutes. It is also important to note that weight management may require longer durations. The final principle is the type of exercise. The two types of exercises are aerobic and resistance training. Aerobic exercise is any exercise that is meant to improve the health of the heart and lungs, like running and swimming. On the other hand, resistance training is meant to improve all major muscle groups. This can be broken down into two types of workouts, multi-joint and single joint. Multi-joint works on more than one muscle group, while single joint focuses on only one muscle group.
Once a person starts following these principles, it is important to see why physical activity is necessary and how it creates benefits over time. Physical activity requires a lot of bodily movement and energy to do these movements. This puts stress on the muscle to work harder and adapt to reach the demands of the exercise. It is important to make sure that a person creates certain goals for their specific workout. This can be used to motivate someone to work harder or make sure they do not slack off on their exercise. Slacking off can lead to detraining of a person's muscles, in which they lose muscle mass after not exercising for a long period of time, around 2 weeks. It is also important to overload your body when you want to show progression and improve your fitness level. The benefits of following these important aspects are monumental for a person's health. Reaching fitness goals show progress and can help people feel better about themselves physically, mentally, and emotionally. Research has also shown that working out and exercising regularly can minimize the progression rate of cancerous tumors.
All right, go.
Physical fitness has a strong correlation with good health. Those who participate in physical fitness are associated with a lower chance of developing some chronic diseases and other health conditions. Muscular strength and endurance fitness can help with individuals' health. They can improve their bone mass, their glucose tolerance, and their muscular tendons integrity. Improving bone mass could reduce the chance of osteoporosis since it is related to bone mass. Maintaining or improving glucose tolerance can reduce the chance of becoming a diabetic. Improving or maintaining muscular tendons integrity can reduce the chance of injury and lower back pain. Maintaining muscular strength and endurance helps individuals to be able to achieve everyday activities. Flexibility is a type of muscle strength and endurance. Not enough flexibility can cause injuries and affects range of motion. Two ways to test flexibility are the genometer and the sit and rest test. The sit and rest test is performed with this box. You want to warm up first, then sit without shoes and have your soles of your feet at the 26 centimeter mark. Then you slowly reach forward as far as possible and hold for at least 2 seconds with your hands parallel and fingertips in contact with the box. Then record the furthest distance reached. The best of two trials, though, body composition is often the division of fat masses and non-fat or lean mass. If the fat mass is too high or too low, it can be associated with disease. Cardiorespiratory fitness helps reduce death from all causes. Cardiorespiratory fitness levels that are high are connected with repetitive physical activity, which result in many health benefits. CR fitness can play a part in primary or secondary prevention and rehabilitative programs. Lack of cardiorespiratory fitness can increase the risk of premature death and mainly from cardiovascular disease.
In the board of sports medicine landscape, exercise physiology is just a small portion of a large spectrum. There is currently not a large professional organization that supports exercise physiology. The one organization that does support it is the American Society of Exercise Physiology, also known as the ASEP. ASEP sets a standard of guidelines for those who wish to practice it. It is the only organization that offers board certifications to those who pass exercise physiologist certification exams. Other organizations that issue certifications but are not board certified are the American College of Sports Medicine and Nation Strength and Conditioning Association. Getting a certification can open up new opportunities for exercise physiologists. One of these opportunities is to go into cardiovascular and pulmonary rehab. In these fields, exercise physiologists can help others by reading their blood and help regulate diabetes and prevent other disease. A new growing field of rehabilitation is oncology rehab. Professionals in this field work with cancer patients and survivors on issues like radiation and chemotherapy treatment and unique problems that cancer survivors get. They also regulate and decrease risk factors of cancer like smoking, poor diets, and lack of physical activity for people who have survived or are at risk for cancer.